So here we're looking at the new daily confirmed cases per million people in the Americas. And Canada, we noticed that there's quite a steep increase. Now the numbers are quite low overall, but it's definitely an increasing trajectory there in Canada. And that's what the concern is in Canada. This direction of travel is not good. Mexico, it's difficult to interpret the data, but there is an upward trend. Argentina, incredible increase and very high figures per capita in Argentina. Compared to the United States, Argentina almost makes the United States figure look modest. But there are still a lot of ongoing new cases in the States. And even with the modified way of interpreting the figures in the United States, that trend is unfortunately up as we head into autumn in the northern states particularly. So welcome to this video. I'm going to focus on the United States today and in this particular video, and we'll see what else we end up doing. But we'll start off with the States. Now, the cases in the United States now are well over 7.5 million officially diagnosed. And the deaths are now 213,000. And the Centers for Disease Control predict that there's going to be another 20 or so thousand this month. 233,000 by the end of October. And what is concerning me is that November, December, January, February are colder than October, and there's more likely to be more spread then. So even though there's some remarkably hopeful things I want to report on shortly from the United States, got some really quite good news I think from the United States coming, but it's not quite yet. We just need that extra few months. We've just been caught out by a few months. It's so frustrating. Before the treatments and the vaccines come online, but they're not going to be there in 2020. We'd hoped they would, but basically they're not going to be. There's an exception to that. There might be some good treatments. Well, there are some treatments, of course, is way better than it was back in March, April, of course. All sorts of extra treatments like the dexamethasone for the acute respiratory distress syndrome. That's a proved efficacy in people that are needing oxygen supplies or people that are being mechanically ventilated, and a lot of other treatment advances as well. But still, there's some significant ones that are coming, but they're just not there yet. The increase in cases has come just a bit early for what we would like. So the deaths are going to increase in October, November and December. I hope I'm wrong, but I think that's probably going to be the case. Now, one thing it's always useful to be able to do is to contextualize what we're looking at. And what we notice here is that 233,000 COVID-associated deaths by the end of October, 213,000 now, 214,000 deaths essentially now for the year 2020. Now just bear that figure in mind, 213,000, and let's look at the other causes of death in the United States to get this some sort of context. Because what's happened now is COVID-19 has moved up to the third major cause of death in the United States. Now, of course, heart disease is still by far the biggest killer, the furring up of the coronary arteries that stops the blood supply to the myocardium, causing different types of, sometimes called heart attacks. We would normally call them myocardial infarctions and conditions of the heart muscle, the pumping heart muscle. So they're still the main cause of death. And then it's cancers, of course. All the different types of cancers. So these are the main causes of death in the United States now. And next after that comes accidents. Now, what this means is if that figure there is 213,000 for the deaths so far from COVID-19 in the United States so far in 2020, then that puts COVID in here, doesn't it? It puts it as the third cause of death in the United States, below heart disease, below cancers, but above accidents. And of course, remember that these 213,000 deaths are not instead of anything, they are as well as, so they are extra. Having said that, a lot of the people that did die from COVID-19 and will die from COVID-19 would have perhaps died fairly soon anyway, but many wouldn't. But that's the context. So you can say that's good news. You can say that's bad news. I don't really know. I'm just giving those figures. Is that good news? Is it bad news? You decide. Tell me. It's hard to relate numbers to people's lives, but this is what we need to do. This is how we come to understand the spread and the pattern of disease. Talking numbers when we're actually talking human beings, but. There we go. So accidents is normally the third. Then chronic lower respiratory diseases, what we often call the COPDs. Chronic obstructive pulmonary disease. This is bronchitis, emphysema and chronic asthma. Chronic asthma is inflammation of the airways. Bronchitis is infection, typically in the larger airways. And emphysema is a loss of the internal structure of the lung, greatly reducing the internal surface area over which gaseous exchange can take place. All very often, or most commonly, smoke-related and smoking-related conditions. Next comes strokes, 146,000. Now, strokes are caused by diseases of the artery, just the same as heart disease is. But of course, that's affecting the heart, that's affecting the brain. Cerebrovascular disease is the next one. Alzheimer's is the next one in the States. Diabetes, influenza and pneumonia, kidney disease, nephritis, nephrotic syndrome. Nephrotic syndrome is where the kidneys become leaky and you leak out protein. So different kidney conditions. Intentional self-harm, suicide, terrible amount of suicides, dear me. And just by way of, I haven't checked the number recently, but just from memory, homicides in the United States last year were around about the 15,500 mark, I think. So murder well down in the numbers, but still a very significant number. So that's where we are. That's the simple facts of the matter at the moment. It's now third leading cause of death in the United States. Above accidents, but below cancer at 213,000 deaths. So I think that contextualization is always useful. And later on today, I've got some more contextualization as well. And now Dr. Deborah Birx, I think she's on the White House team, isn't she? Small private gatherings with people we know. Now, what you find in any outbreak, and certainly been true all through the COVID episode, is there's particular infection drivers, particular groups of people or particular behaviours that are causing most of the new cases. They are the infection drivers. And Dr. Birx here is saying that the main infection driver now, especially in the northeast as we'll look at, is not pubs. It's not super spreader events, bars do you call them, but not pubs or bars. Not restaurants, but people gathering together privately, very often in their own homes, is now the main infection driver. So, you meet with your friends, you're feeling fine, they're feeling fine, and yet the disease is spread because of the pre-symptomatics and the asymptomatics, and that can spread onto the more vulnerable. So bear that in mind. It's not, if you want to socialise with your friends, then ideally do it outside. Of course, in the north of the United States, it's getting pretty cold now. But the point is, in the past 2 weeks, 25% increase in cases in the top right-hand corner. Northeast of the United States, Pennsylvania, New York State, New Jersey, Connecticut, Vermont, New Hampshire, all in that cluster. Now, we had seen quite a big increase in cases over the past few weeks before this in the Northwest. I mean, we know there's increasing cases in Florida, Texas, southern states, California. But now the increasing cases had been less in the northeast, but now it's more cases there, 25% increase in the past 2 weeks. So much more significant than it has been. So, and worth bearing in mind that many of these cases are spread by the most innocuous or apparently innocuous small-scale social gatherings. That is the current main infection driver. Doesn't mean say you can't catch it in a bar, doesn't mean say you can't catch it in a restaurant, doesn't mean say you can't transmit it at a sports event, but that they seem to be the main drivers at the moment. Now, New York City is remarkably disappointing. I mean, I've talked to people in New York and they say things have been very quiet there over the past few months. I mean, literally quiet, less people out and about. And we were hoping that there was some herd immunity in New York, but cases are now increasing again in New York City. So around about the 500 cases per day at the moment, which is the highest level since June. And if you want to catch a show, then Broadway unfortunately is closed until June 2021 at the earliest. And that will largely depend on the progress of the vaccination, I would think. Now, I know there's something coming off in the United States on the 3rd of November. It's not long now. But we try and use evidence-based and facts on this podcast and not be political. My apologies if I slipped once or twice. Try not to make political comments. But all I can say is one 74-year-old man is looking much better. Now, whether you like him, hate him, love him, doesn't matter. He's looking much better. I simply reported he's looking much better. And he says he's no longer taking any medications. So we assume he's not. Now, I imagine he's still on. We think the president might be on statins and we think the president might be on low-dose aspirin. So I imagine he's carrying on with those. But he's looking way, way better. Now, in any one case, we can't say why someone is improved. What we need to do is take thousands of cases and say, well, this treatment works for thousands of cases. Therefore, because this is true in general, generally true, it's more likely to be true in a specific instance. That's called deductive thinking. What we mustn't do is say, well, this works for me, therefore it's going to work for everyone. That's inductive thinking, and that's much less rational. But I am going to mention again the antibody treatment that the president received. Now, he said he felt better as soon as he got it. Now, that is anecdotal. It has no scientific validity. We would need to do that on thousands of people to find out if it's true. But the reason I'm going back to it is this makes perfect physiological, immunological sense that this treatment should work. Now, all the other treatments we've looked at, ivermectin, hydroxychloroquine, they all have antiviral properties to varying extents. Hydroxychloroquine acting as the ionophore to let zinc into the cell to carry out antiviral activities. So there's reasons why they should work in vitro, but very often the concentrations need to be quite high and they add side effects and all sorts of things. And we can still argue about them now. We've looked at epidemiological data that suggests that hydroxychloroquine does have efficacy. Not going into that debate now. But the antibody treatment just makes perfect sense. The antibodies, the immunoglobulins, are exactly what the body makes in order to combat the infection physiologically. So this is duplicating a physiological process. It is taking cells that make these appropriate anti-SARS coronavirus 2 antibodies. It is brewing those cells up by the billion, trillion, massive litre, huge flasks of those cells, and they are producing these antibodies. And those antibodies are the same as the ones that you would make had you been naturally infected. You see why I'm so excited about this? It's duplicating the physiological process. So I am really hopeful that this could be, I don't like the word curative, but the closest we could get to what we might call almost a curative treatment. The reasons for why this is likely to be effective are in place. Whether it is or not, we'll only know with large-scale studies. But the reasons for optimism are there, in my view. And the president did say that he's going to make this treatment available free. So basically, that is a political commitment in the United States now. If he's re-elected, he'll have to follow through on that. If Mr. Biden is elected, then it would look pretty bad if he didn't follow through on that. So I suspect this is going to happen now, and this is remarkably encouraging. And hopefully the price will come down. So Operation Warp Speed, part of this Operation Warp Speed, the US government has now awarded best part of $500,000 to AstraZeneca to make 100,000 extra doses of antibody treatment, the monoclonal antibody, MAB, monoclonal antibody treatment. It's actually 2 different monoclonal antibodies combined, I believe. So they've given them money to make 100,000 doses, and that's just the start. Hopefully, Regeneron in July they were making treatment for 300,000 doses, but this is government funded with the aim of making it free. Now, whether this happens or not, I don't know, but this is the commitment. And this is I actually got this from Reuters, which is usually fairly reliable. So if you're in the United States, keep me better informed, of course. I read all the comments I have time to do. Especially this is going to be useful for high-risk populations, the elderly, those with comorbidities especially. Government was expecting to provide more than 1 million free doses, or is expecting to provide 1 million free doses. So they put the money down. AstraZeneca are working on it. The government have made the commitment. This could be a complete game changer. So I'm encouraged. But one of the reasons I do these educational projects is just the sheer injustice that so many poorer people in the world don't have access to good quality healthcare, and by giving people information, hopefully that can help to offset that in some way. And this is being targeted to everyone that he needs it, as far as I can tell. Let's hope it works out. Regeneron and Eli Lilly applied for FDA emergency use authorization. So let's see if that happens. Now, Eli Lilly, I don't think they're part of the Warp Speed. But the Regeneron, I think now, I'm not sure if they are now or not, but they're certainly making the 300,000 doses. Applying for FDA emergency use authorization. I suspect it will be given because there is some provisional data, and it's not published, but as far as we know, the provisional data is indicating this is safe. We await the papers, of course. Trouble is, we've got the increasing cases now, so it's always we always seem to be just a little bit behind the curve. Yes, Eli Lilly is not on Warp Speed yet. Now, trials for prophylaxis and treatment are being instigated, as far as I know now. Now, this was interesting, prophylaxis. So, what would happen here is if you give a vaccine. The vaccine stimulates the individual to make their own antibodies, their own T cells and all that kind of stuff. And because the individual is, or if someone's exposed to the virus, they make their own antibodies and their own immunological response. And if you're making the antibodies yourself, that's called active immunity. So vaccination induces active immunity. But if you're given the antibodies that some other cell culture or someone else has produced, that's called passive immunity. So the idea here is you would give these antibodies, then if the vaccine, so you give me the antibodies, then if I get the infection, the antibodies would attack that infection, kill it before it had time to infect me. So if I had large amounts of circulating antibodies to SARS coronavirus 2, it would be assumed that that will give me a good degree of immunity, probably at least as good a degree of immunity as active immunization from a vaccine would give. And what astounded me is that what I've been reading is that this prophylaxis can last for 12 months. Now, I really didn't think it would last this long. I was expecting 4 weeks, 4 months, that kind of time span. for the antibodies to remain active in the blood before they gradually deteriorate and go away. And of course, you're not making new ones as you are with active immunity. And you haven't got the memory T cells, and you haven't got the memory B cells, and you haven't got the other aspects of the immunological response, like the immunoglobulins in the mucous membrane. You haven't got that, but this is hoping that the immunity is going to last for 12 months. And of course, that gives us plenty of time to get a vaccine. So we can actually use this as a prophylaxis for nurses, doctors, paramedics, care workers, all the frontline staff that would benefit from that straight away. Now, if that works, that is a real significant thing while we wait for the active immune generating vaccine. And also, of course, it would be used for treatment that already have people that already have it. As in the president's case, the president already had the virus. He was given the antibodies, and the antibodies then, we assume, attacked the virus, and we think that might be why he started feeling better. So there we go. That's just a brief update for the United States. But let's just finish on this graph, reminding us of where we still have to go. Because we've got potential increase here, and yet of course Argentina's in the southern hemisphere, so they're heading into their summer now. Hopefully that will help the situation, but for most people in the United States, and certainly in Canada, we're heading into winter. And while there's great hope, there are these concerning cases in winter, and the anticipated increase in deaths for October and possibly the months after. But the light is well and truly there at the end of this tunnel, but we've got a few months to go yet, unfortunately. So, do I need to say it again? We need to do this. Let's just close on for the United States, we'll close on the Rononian model from Ron in Wisconsin. We looked at it yesterday. But you see, each of these slices of cheese has got holes in it. So the virus might get through that one. It might even get through that one, but then it could stop at that one. But if it gets through that one, through that one, and through that one, and through that one, it could stop at that one. And each of these slices of Swiss cheese is a preventative measure. So washing your hands is a slice of Swiss cheese. Maintaining distancing is a slice of cheese. Wearing your mask is a slice of cheese. Ventilating a bar is a slice of cheese. Using a COVID symptom tracker app is a slice of cheese, a contact tracing app. All of these things are preventative measures. Ventilating a classroom is a slice of cheese. And the more slices of cheese you have in, the more likely you are to stop the virus. So do protect yourself with as many slices of cheese as possible. But I'm going to leave that there for the United States. Now, I've still got a few things to do today. I've got Australia and some really poignant things from other parts of the world, but I've been told my videos are too long, so I'm going to leave that there. And if you want one long video, do let me know. It makes no difference to me. Once I've prepped it out, it's just a matter of teaching it all together or in sections for me. It doesn't really make too much difference, so let me know your preference. And that's us for this one. Thank you for tuning in, as always. You're always very welcome.